GINA guidelines have been making our lives easier by giving more importance to already existing biomarkers. For instance, blood eosinophil count, fractional exhaled nitric oxide, sputum eosinophil count, uh, blood IgE levels, specific IgE levels. These are some of the things which GINA has been giving more importance to make the diagnosis easier, but just not diagnosis, predict the treatment, prognosticate a treatment, monitor the treatment. More importantly, phenotypic assessment of asthma is done well by these biomarkers. Blood eosinophil count, if it is more than 150 per microliter, it is suggestive of T2 high asthmas. Of course, there are variations between the genders, diurnal variations, whether you're a smoker or not. All these influence, but by and large, this will tell you that this patient is going to respond to the treatment or not. And if the levels are more than over 300, the biologic treatment will help those type of patients. Fractional exhaled nitric oxide, if it is over 50 parts per billion in a treatment naive patient, it is suggestive of T2 high asthmas, and they are going to respond to the inhaled corticosteroid. This will also help us in monitoring the patient. For instance, if a patient is on inhaled corticosteroids with a moderate dose, and if the levels are around 25 parts per billion, it is still considered high. And if the patient is on a high dose inhaled corticosteroids and the levels are around 20 parts per billion, it is still suggestive of high fractional exhaled nitric oxide. And there is scope for us, either by introducing the treatment or by changing the treatment, we are going to see the response to the patient. Sputum eosinophil count is another important thing which will tell us whether it is a corticosteroid responsive asthmas or not, but it is not widely available. So this way, GINA has been making our lives easier than ever.